Rehabilitation engineers have very different roles in different environments. First role is being what our therapists coined as the Geek Squad. So kind of technical experts in products and technology. The other hat, if you will, that we wear as a rehab engineer in the clinical setting is probably the one I like the best. It's when something doesn't exist, we make it. So that could be 3D printing, it could be bolting together two different mounts that weren't meant to go together, or it could be really any combination of that. And like I said, we use 3D printing, but we also use other rapid fabrication tools like laser cutting, and we also do custom electronics. I think what's neat is that engineers are certainly involved in the medical field, but typically more behind the scenes, developing things, devices or tools that are then used with patients by clinicians. Within the assistive technology world, there's a unique opportunity for engineers to work directly with patients and finding the exact solution that's going to help someone have more independence and have better quality of life.
Some of our biggest programs are cycling. We have upright cycling, recumbent trikes, recumbent tandems, and hand cycling as well. We have shooting sports, air rifle, archery, top shooting, some team sports like wheelchair basketball, aquatic, swimming, kayaking, a lot of variety of different things. We've had a lot of opportunities to work with the Assistive Technology program to develop personalized items for athletes if they have a specific thing that they need that's not available on the market. We've been able to build it for them. We've developed a sip and puff trigger for shooting, which has been very popular. And we also developed a cue holder adapter that goes over a billiards cue stick to help individuals that only have the use of one arm while they're playing pool. We are one of the largest programs in the country in both participation and programs that are offered. We compete pretty heavily with Texas and Florida and Tampa, which is a fun rivalry that we have.
I assess and evaluate patients for communication devices. So those are devices that help people who have had like strokes or brain injuries, and they can range from low-tech options, so something that's like a paper system, all the way up to devices that talk for you, as well as complete evaluations and treatment for electronic cognitive devices, and those could be considered pill boxes, smart pens, apps for memory, just depending on what the patient needs. A lot of times the patients that are getting communication devices also have other impairments, so difficulty using their upper extremities or lower extremities, some may be wheelchair bound, so being able to have somebody set up the device and give them the opportunity to communicate is huge. Assistive technology, we use it every day. Timers, alarms, reminders in your phone, it makes a difference. Without it, some people can't communicate at all, so I can only imagine what it's like to say something as simple as I love you, or I'm hungry, or I need to go to the bathroom, and just in the little things that we don't think about, or that otherwise may not have been possible.